This presentation aims to explain the treatment of deep cavities at the Tokyo International Dental Clinic in Roppongi. If you watch this video and agree, please fill out the consent form for the stepwise technique treatment. If you have any further questions, please ask us. This video explains the procedure, problems, prognosis, treatment fee, and time required to treat a deep cavity. If you have a deep cavity, the nerve is usually already affected. Sometimes, you are sensitive to cold or hot water. But sometimes the cavity is too big, and the nerve doesn't react to the stimulation. In the radiograph, the radiolucent area is very close to the nerve system, which is red. If the cavity diagnosis is R4, root canal treatment is usually indicated. However, if the patient doesn't have spontaneous pain and wants to save the nerve, the stepwise technique is an option. The stepwise technique needs 2 sessions of grinding the tooth. In the first phase, we removed all the infected areas around the peripheral area of the tooth without touching the location very close to the nerve. We then placed the medicament on that surface to regenerate the tissue and avoid exposing the nerve. We placed the plastic temporary filling to cover the medicament to seal it off, and we waited 6 months to 12 months. In the second phase, we removed part of the temporary filling, all the medicament, and the previously thought soft infected part of the dentin near the nerve. We then placed the plastic filling. You need 75 minutes for the first treatment and 45 minutes for the second treatment. The European Society of Endodontology made a guideline for this technique in 2019. It is quite a new technique. Previously, many cases required root canal treatment, but the concept is now changing. This case was treated using the stepwise technique in 2019. The cavity was very deep and below the gum and usually needed to be extracted. However, we saved the tooth at that time using the stepwise technique. We observed the sensibility of the nerve and took a radiograph. This tooth survived for at least 6 years in 2025, with the nerve still vital. The stepwise technique will not always succeed. This is an elderly patient whose nervous system is very weak. However, the patient wanted to try the stepwise technique, and at the second phase, the nerve system was exposed when we removed all the remaining soft dentin. If we find the nerve exposed at this point, we cover the exposed area with the medicament and fill it with plastic. Unfortunately, capping the exposed nerve doesn't go well. The reported success rate is 50% in 3 years, according to the study by Bowell et al. Published in 2024. Furthermore, the failure rate in 10 years is reaching 80%, as reported by Barthel et al. In this case, I tried to clean the wound surface and took a microbiological sampling from this exposed area to see if any bacteria existed. This is the result after 2 weeks of culturing bacteria. So many bacteria were found in the wound area. We noticed very few bacteria still existed after the rigorous irrigation, and we finally decided to go for the root canal treatment. These are some examples of the first phase treatment and the second phase treatment. The treatment fee is 60,000 yen plus tax each time. The nerve may sometimes be necrotic without clinical symptoms, so you need a follow-up. The success rate is reported to be about 70%. Please call us immediately if you develop any clinical signs, such as sensitivity, pain, or swelling. Otherwise, we will observe the tooth. Thank you very much for listening to the procedure for the stepwise technique for a deep cavity. If you have any further questions, you can discuss them before the treatment. Otherwise, please fill out the consent form for the stepwise technique.